buttercup, you're a Barbie doll. Show them all what I'm made of. Strut down the hall, won't stop till I get enough.
Okay, so it's the most wonderful time of the year. Unless you get hit with the other kind of holiday spirit, right?
Right.
Stomach bugs, specifically all this news about the uptick in norovirus cases.
Right.
We want to do a deep dive into this, and you shared this CBS News article, pulled data from the CDC.
Yeah.
So let's break it down. What's really going on?
Well, CDC reported 91 norovirus outbreaks in the first week of December alone.
Wow, 91 outbreaks.
That's a big jump.
It does sound like more than just a couple of isolated incidents.
Yeah.
But before we go any further, can we back up for a sec?
Sure.
What does the CDC even define as an outbreak?
Oh, that's a good question.
Is that like one family gets sick, or is it something much bigger than that?
It's not just a single case or anything.
Okay.
An outbreak means a cluster of illnesses happening in a specific place or within a specific group of people.
Got it.
And you're right, that number in December, which is already peak norovirus season, is definitely a signal that something's going on.
Yeah. And speaking of clusters, this article mentions a bunch of cruise ships having all these issues.
Yeah.
Hundreds of passengers getting sick. Not exactly the relaxing getaway you'd hope for.
Definitely not.
And actually, 3 different ships, right?
Yeah, 3 different ships. And actually, December 2024 had the highest number of cruise ship norovirus outbreaks for the whole year,
Really?
according to the CDC.
So are cruise ships just norovirus hotspots? Is it just all those people in close quarters?
Close quarters are definitely a factor.
Yeah.
You've got hundreds or sometimes thousands of people sharing those dining halls, restrooms,
Right.
touching all the same surfaces.
Oh, yeah.
And then you combine that with the fact that norovirus is insanely contagious.
How contagious are we talking?
I mean, as few as 10 viral particles can make you sick.
10? I didn't even know viruses came in particles.
Yeah.
What does that even mean?
Basically, these particles are the infectious bits of the virus.
Oh, okay.
They latch onto cells in your body and make you sick. And with norovirus, it doesn't take very many of them at all.
Got it.
That's why it spreads so easily, especially in environments like cruise ships.
Okay, so close quarters plus a super contagious virus
Right.
equals a recipe for, well, not a good time.
Definitely not.
But it's not just cruise ships, right? This article also mentions cases popping up on land, like in Minnesota.
Exactly. And they've seen double the usual cases there this December, which means it's circulating in those communities.
Yeah, so this is not just about avoiding the buffet line on your next vacation.
Right.
This is about understanding how this norovirus works in general.
Yeah.
Can we maybe talk a little bit more about the basics? What even is norovirus?
Yeah, for sure.
And how does it make you sick?
So norovirus is actually the leading cause of foodborne illness in the U.S.
Really?
58% of those cases.
Wow, 58%. That's a lot higher than I would have thought.
Yeah, and it's not just, food poisoning from like undercooked chicken.
Yeah.
We're talking about illnesses that are caused by contaminated food or water, contact with a sick person,
Got it.
or even just touching a surface that's been contaminated.
Okay, so if you do catch this thing, what kind of symptoms are we talking about?
Well, it's not pretty.
Yeah.
We're talking sudden onset of vomiting, diarrhea, nausea, that whole not so fun package of gastrointestinal distress.
Not how you want to spend your holidays.
Nope.
How long does this misery usually last?
Typically, symptoms start 12 to 48 hours after you've been exposed.
Okay.
And most people recover within 1 to 3 days.
Okay, so not usually a serious long-term thing.
Right.
But if it's that contagious, it must have a pretty big impact.
Oh, absolutely.
Yeah.
While most people bounce back pretty quickly, we're still talking 19 to 21 million illnesses annually in the U.S.
Wow.
And it does lead to about 900 deaths each year,
Oh, wow.
primarily in older adults.
Okay.
Dehydration is a real concern, especially for young children and the elderly.
Yeah, that puts things into perspective.
Yeah.
So we need to take this seriously.
We do, and that's why understanding how to prevent it is so crucial, especially with all the holiday gatherings and stuff.
Okay, so before we swear off all the holiday parties and potlucks, how do we avoid becoming part of that 58%?
Yeah.
What can we actually do?
Number one, the most important thing is wash your hands
Okay.
thoroughly and frequently
Okay.
with soap and water, warm water.
Okay, so Mom was right all along.
Always right.
Hand washing is king.
Yes.
What else?
Disinfecting surfaces diligently is also crucial,
Uh,
especially those high-touch areas, doorknobs, light switches, countertops, all that.
Makes sense. And what if you're the one who's not feeling so hot?
If you're sick, do everyone a favor. Do not prepare food for other people.
Okay.
Even if you think you're being careful, it's just too easy to spread.
This is where that advice from the CBS article, Dr. Leana Wen, comes in.
Oh, yeah.
She was a big advocate for all of these same steps.
She is, and her perspective is so valuable because she's not just talking about, the science. She's considering the practical realities of how people actually live their lives. So,
Yeah. All right, so what happens if, despite all of our best efforts, the norovirus gremlins still manage to get us?
uh-oh.
Is there a magic cure? Is there anything we can do?
Unfortunately, there's no specific treatment for norovirus itself.
Okay.
The focus is on managing those symptoms and preventing complications.
So what does it actually look like?
Hydration, hydration, hydration.
Okay, so like water, clear liquids,
Exactly.
no coffee, no tea.
Nope. And definitely no alcohol.
Okay,
Those can actually dehydrate you further.
good to know. So when should somebody actually seek medical help?
If you're starting to see signs of dehydration, especially in those more vulnerable groups, young children, the elderly, then it's time to go to the doctor.
Got it.
Yeah.
All right, so we've covered a lot of ground here. We've gone from stomach bug to understanding that this norovirus is a pretty big deal
Yeah.
and that prevention is absolutely key.
It is.
But with something this contagious, it makes you wonder, what is our responsibility, not just as individuals, but as a community?
That's a really good question.
Right. Like, I can be a hand-washing champion over here, but if the person making my salad isn't following those same precautions,
Yeah.
it puts us all at risk.
Exactly. And it just highlights how important things like food safety regulations and public health communication are.
Right.
Even just having a general awareness of those good hygiene practices as a society can make a huge difference.
It's almost like this shared responsibility for well-being,
Yeah, exactly.
especially now when we know that that risk is so much higher.
Right, and think back to those cruise ship outbreaks.
Yeah.
While individual passengers can certainly take steps to protect themselves, the cruise lines also have a huge responsibility
Right.
to maintain sanitary conditions and to respond quickly if there's an outbreak.
Yeah, it's a two-way street.
It is.
People making smart choices, but also institutions creating environments to help support those choices.
Yeah. Absolutely. And it's not just about avoiding getting sick ourselves either. It's about protecting those more vulnerable people. Remember, we talked about the higher risks for young children, the elderly, those with weakened immune systems.
Yeah, dehydration can be a real danger for those groups.
Exactly. So when we take steps to prevent the spread of norovirus, we're not just protecting ourselves, we're helping to protect those folks who are more likely to have serious complications.
It's like this ripple effect of responsibility.
It is.
What we do or don't do can really have consequences beyond ourselves.
Well said. And it all goes back to something we talk about all the time on this show.
Yeah.
Knowledge is power.
Yeah.
The more we understand about how these viruses spread,
Right.
what we can do to minimize that risk,
Right.
the better equipped we are to make those smart choices for ourselves and for our communities.
It's like that saying, an ounce of prevention is worth a pound of cure.
Yep.
Except in this case, there is no cure. So prevention becomes even more crucial.
I couldn't agree more.
So listeners, armed with all of this newfound knowledge about norovirus,
Yeah.
let's make a pact to be extra careful this season. Let's be those hand-washing champions.
Yes.
Those surface disinfecting superheroes.
Yes.
And those responsible citizens who stay home when we're feeling under the weather. We can do this.
We can. And remember, if you do end up facing that dreaded stomach bug, focus on staying hydrated, listen to your body.
Yeah.
And when in doubt, always reach out to your doctor.
Solid advice as always. But before we wrap up this deep dive on the world of norovirus, I have one more question that's been on my mind.
Okay.
We talked about individual responsibility. We've talked about institutions.
Right. Yeah.
What about the bigger picture? What about like the systemic factors that might be contributing to the spread of viruses like norovirus?
That is a great question.
Right. Like, are there underlying issues like access to healthcare?
Right.
Or things like sanitation infrastructure?
Yeah.
That might play a role.
That's a really interesting question and one that deserves a lot more exploration.
Right. It's like we can treat the symptoms,
Yeah.
but if we don't address the root cause, are we just going to see these outbreaks happen again and again?
Exactly. So as you go about your day, think about those bigger questions.
Yeah.
Think about how interconnected health is.
Right.
The impact of things like social determinants of health.
Right.
The ways in which we can work together to create a healthier and more resilient society for everybody.
That is some serious food for thought,
It is.
and not the kind that's going to give you a stomach bug.
No, not at all.
Folks, we've reached the end of our norovirus deep dive.
We have.
We hope you learned something new, maybe had an aha moment or two.
Yeah.
And maybe even had a few laughs along the way.
A few laughs.
Remember, knowledge is power. And when we share that knowledge, we make each other stronger.
We do.
Stay curious, stay informed, and most importantly, stay healthy.
Stay healthy.
Sound the alarm. I'm coming up. We'll have a ball. I'm sweet like a buttercup. You're a Barbie doll. Show them all what I'm made of. Strut down the